When we woke up this morning, the news was that senators had worked out a deal to send Americans direct cash payments to get them through the coronavirus crisis. Now that plan may be on the rocks. Senate Democrats had fought the bill, securing oversight rules for a $500 billion fund to secure businesses. That includes rules blocking the president, his staff, Congress, and their families from getting any of those funds. But this afternoon, a group of Republican senators, including Florida's Rick Scott, said they don't want the relief aid to make it more lucrative to be out of work than on the job.
We know a lot of people can't work for a variety of reasons, some because government sets it up, others because the economy is hurt. So we've got to help them. But the moment we can go back to work, we cannot create an incentive for people to say, I don't need to come back to work because I can do better someplace else. These employers are going to need these workers to rebuild this economy.
Very few people are going to turn down a 24-hour deal not to work. To work for 15.
Now, the virus and the fact that you can carry it for up to 2 weeks really has meant some major changes to the way that doctors treat patients who may have COVID-19. First Coast News' Eliza Powell is on your side, speaking with a physician at UF Health tonight about the future of virtual medicine.
With COVID-19 spreading across the country and the First Coast, UF Health's doctors are using telemedicine to make sure that they can still see their patients safely.
How would you describe it?
Doctors at the hospital have used telemedicine before, but because of the virus, virtual appointments have ramped up.
Our telemedicine visits have increased maybe by 70%, 80%, almost 100.
Through the clinic, patients are able to see a physician for non-emergency virtual visits.
We want to be here for them. We want to make sure that they have access to care and immediate access to care.
Patients call the office to schedule an appointment. At the appointment, they check in online. Then the doctor comes in the session and proceeds like any in-person visit.
Patients really love the idea that they're scared. They don't want to come in. They know what social distancing is. They're trying to comply.
If a patient does need to physically come to the clinic, a doctor or nurse will come see them at their car. The clinics are also set up with social distancing practices in waiting rooms and patient rooms. Most healthcare providers at UF Health say they'll be using telemedicine until the global health crisis is over, but some say they'll continue using it for non-emergency visits even after the global health crisis ends because it's convenient for them and their patients who can't always physically get to the doctor's office. In Jacksonville, Eliza Powell, First Coast News on your side.